Oh, you're welcome back. We are still here, and thank you to Ganyo Dread for that. It's a wonderful morning, and we're getting into the next segment. I'm going to introduce my guest very soon. As you know, and as we announced before, it's Menstrual Hygiene Day, and we're going to be talking with our doctor, Dr. Emmanuel Amankra, who is a medical officer of the Lekma Hospital. We're going to be talking to him about menstrual health. Now, the hashtag is Breakfast Daily. The WhatsApp number is 0550-585-832. Stay with us and communicate with us with your questions and your comments. And let me introduce to us our guest, Dr. Amankra. You're welcome.
Thank you very much.
How are you doing this morning?
Well, I'm okay. Yourself?
Yeah? I'm well. I'm good. And it's interesting because we're making some comments and giggling about the fact that two guys are going to sit on the show and talk about menstrual health.
Exactly.
Yeah, but I'm excited because I think it's important, particularly for men, to understand the issues of women and the women in our lives and what it is that goes on with them, every month and so on. Now, first thing I want to, as a way of getting into the conversation, how extensive is the challenge of misconceptions around menstrual health, generally speaking, in your practice as a doctor?
Okay, so I think it's quite widespread, and most importantly, in our sector or in our setting here, in the African setting, where things are not so much explained. So whilst growing up, a young girl hears all these taboos and hears all these things, myths and everything. She grows up. Then in school, if it does happen, the guys tend to tease or laugh at her. So it's seen as something that's a bit shameful. So as they grow up, their timidity in that aspect of their life also shows. So you realize that there are lots of widespread issues when it comes to menstrual health, because people are not so keen on talking about it. Because right from the start, whilst growing up, it's been termed as an area where you're not supposed to talk about. It's just supposed to be something inside. But I believe the theme for this year actually is it's time for action.
Okay.
And I think it's a start where we have to let people know you have to talk about it. And I think City TV took a start where we have two men discussing menstruation.
Yeah.
Yeah.
Okay, let's broaden it a bit, and then we'll come back in and zero in on the particular period of the 5 to 8 days or whatever it is that there. Let's look at the entire cycle.
Okay.
All right, and take us through what the average woman will go through in, is it 28 to 32 days? Just take us through that, what happens in the month.
Okay, so the first thing we should all know is that everyone is different.
Okay.
Everyone is different. Now, menstruation basically is the bleeding as everyone was shedding of the uterine lining and then the egg that was released, the ova. Now, the cycle, averagely, an adult woman, we say it's 28 days.
Okay.
Now, we know that there are some variances with this, which also falls within the norm. Going deeper, you can say even from 21 to 45 days. Yes.
I see.
Yes, these are all variants of norm. So you'd realize that someone might say, oh, my menses comes, it's not so regular. It comes, and after 2 months before it comes, after 2 months before it comes and everything. These are all variants of norm. And what research has shown is that usually whilst you are early, you are quite younger, the spacing tends to be more wider than when you grow old. Okay. Let's have in mind that as you're growing older, you are getting close to menopause where you are ending it.
Okay.
So, and basically it starts between the ages of 8 to 12. Now, it's been shown that the developed countries actually have ladies starting their menstruations quite earlier than developing countries.
What would be the reason for that?
Well, I think change in diet, their diet modalities, lifestyle, so that tends to make them age or grow faster.
Okay.
If you look at a 10-year-old girl who grew up in Ghana and a 10-year-old girl who grew up in the United States, there's a difference. You can look at them and realize that there's a difference. So this can account for that. So aside from that, so basically, but averagely, we know it's 28 days. So I brought this one, so you know that 29 to 45. So there's always this range. That's if you have,
so what you're saying, Doc, is that it's normal.
Yes.
It's just a variant,
of the norm, basically.
Okay.
That is it. So, and normally, So the menstruation, so we use 28 as an average when doing the calculation and going through the whole cycle. So we usually count from the first day of the menses.
Okay.
That's when we say you're starting your menses. Or when we come to hospital and we ask you, when was your last menses? We actually expect you to tell us the first day of your last menses. So the first day. Now, so the first day, usually we expect that you bleed from 3 to 5 days. The bleeding 3 to 5 days. And then usually, for most people, it goes in this decrescendo manner where it starts higher and then reduces. The volume reduces.
Okay.
So for
the volume of blood.
Volume of blood.
Okay.
Yes. So we have 3 to 5 days. Then after the 3 to 5 days, while everything has been shed, the lining of the uterus has been shed. We have the egg also being shed. Then we have a period where the body recovers, where some people may term as the safe period. The safe period in quotes. We'll talk about why I said it's in quotes, because the safe period may not be that safe.
Okay.
So after that, then we have the part where ovulation, where another egg is released. Then after some time, then since the body already protects or gets ready for implantation, if fertilization does not happen, then we go to the cycle again where it is shed again. So basically, averagely, this runs within 28 days. So you know the bleeding is supposed to be between 3 to 5 days. Then afterwards, around the midpoint, let's say around 14 day, you expect ovulation to occur. And then get into the end, shedding starts taking place.
Okay. Now, the safe period is a very fascinating concept for me, because I know when as boys get together and we're talking, one of the conversations is sex without condom, because I think that we have all these kinds of funny myths and jokes that we make about the whole idea of using a condom. It's like washing your hands with gloves on, all those kind of things. And then it's like nobody washes their hands with gloves on. And so, why are you using, why should we have to? So then it takes your mind to the place where is there a possibility of having sex with your steady partner and not getting her pregnant?
Okay, so the safe period is actually a period where it's just after the menstruation. So let's say from day 7 to maybe before ovulation, day 12 or 13.
Okay.
Now, it's supposed to be safe.
So it's about 4 or 5 days?
About 5 days.
Okay.
So it's supposed to be safe for the woman in that sense that, so there's no matured egg that has been released. The uterine lining are not so, it's just been shed off. Now, the funny thing about it is, now the sperm can averagely last 3 to 5 days. That's the normal lifespan of a sperm, 3 to 5 days. But we do have some stubborn sperms that last up to 7 days.
Okay.
So good. You have sex in your safe
Strong
period.
sperm or stubborn sperm?
Oh, well, let's leave it as stubborn for now. So you have sex in your safe period, but we have the sperm still there. So let's say you have sex on your 12th day. The sperm is there for 3 days or 4 days. You release your ovum on day 14.
She will come and meet him.
Congratulations, you're pregnant. So you realize there are times where people are like, oh, it was during the safe period, but the girl is still pregnant, and they doubt they are responsible. Well, your sperms are waiting for the egg.
I get you.
So the safe period is not really that safe.
Okay, so what about the period, knowing, as you said, the egg is fertile for what? A day, 2 days?
About 3. The egg actually is released, so we have the whole anatomy. Once the egg is released, it moves from through the fallopian tubes, and then if it's not implanted, it just go. So that takes almost like 7 to 10 days. So as it's moving, the sperm can also go meet somewhere. Optimally, it comes to the uterus, and then fertilization occurs, and then implantation occurs. Okay, so there's a whole period after ovulation where the egg has been released. Now, ovulation means the egg is matured and has been released. So it's ready. From that time till the time where it is not being used, so it's going to be shed. So you have almost like 10 days in between.
So wait, you're saying that the entire period after ovulation is unsafe?
Yes. Because the egg is already ready. And then until you start bleeding. Once you start bleeding, we know it's out or it's coming out. Okay. There are some people who also try to have sex during their menses as well, even though that is more prone to infections and it's not really advised.
Yeah.
Yes, even though at that time there's no egg or anything like that.
I see. Now, let's zero in and come to the issue of hygiene.
Okay.
Okay, during the blood flow period, the menstrual period.
Okay.
What are some of the common challenges that ladies go through, or in your practice you notice that cause infections and other things in that particular period, the causes of those?
Okay, so hygiene is very important, and then the importance can't be understated. So once during the bleeding period, the changing of the material that the person is using, either a sanitary pad or tampons, but I think in Ghana mostly sanitary pads that everyone uses. You have to change it regularly. Averagely within 6 hours. It's up to that after every 6 hours you change it.
Yeah.
Yes, but one challenge is having the time. People don't change it. Sometimes someone can have it on the whole day till they go home. Because the person is working and they can't change it at work. So it goes to work from 8 to 5 p.m., stays in traffic, gets home like 7:30. So she leaves the house 6 o'clock to miss traffic and everything. So from 6 a.m. to like 7:30 p.m. or 8 p.m., the sanitary pad is still there. Okay? And then this has gathered some stuff that's supposed to come out. So that is no good. And we also advise that you wash down at least as a whole bath at least once. At least once. And also when you visit the washroom.
Once a day?
At least once a day. When you visit the washroom, you have to wash that area and then clean. When you're cleaning too, we always stress on the fact that you don't clean from back to front. You clean from front to back.
Okay. Explain why.
Okay, so the thing is, basically, some people, if you clean from back to front, you're actually introducing some germs from the rectal or anal area into the vagina, and it's one of the causes of infections, recurrent infection in some women as well. So we always try to tell them from front to back, not the other way around.
Okay.
So it's very important that during that time you observe this as well. So basically, the main thing is the changing of the pad regularly, the washing of your hands, of your genital area, and also a general body wash as well. So every time you change the diet and the sanitary pad as well, you also have to wash your hands with soap and water.
Okay.
Because you may have contaminated your hands and you'll be interacting with other people.
Okay.
So, yeah. But the challenges are, one, the regularity of changing the sanitary pad. Sometimes it's a bit, considering their work and how they go to school or class and everything, they're not able to change it like how we recommend. Every 6 hours you have to change it. And also, getting water to wash and clean after every washroom visit is also not so conducive, depending on where you find yourself or the circumstances you find yourself.
Okay. Yeah. So there's a question here on WhatsApp. They say that there's schools that have no washrooms. Even right here in Accra. Yeah. Okay, we have schools like that. How does this affect the female students? And then who are menstruating, of course, and then also there's a reference to I don't know if this falls in your line of the remit of the conversation we are having, but it says the taxes on sanitary pads as well. So I don't know what comments you will have to make on that. The issue of lack of washrooms in schools. For the female students.
For that, it's actually a public health concern, because we should have washrooms where these ladies can actually change and clean themselves. It's very important, because I think it's something that is being talked about, that adolescent ladies or adolescent girls would have the opportunity to observe good hygiene by availability of water, cleaning and washing. On the tax on the sanitary pad, I don't think I'll be the right person to comment on it. It falls outside my jurisdiction.
Okay. So another question. This is from Michael. Michael, who is in Tamale, and he says that, Doc, my sister always experiences abdominal pain during her menses. What's the underlying cause of this, and can it be prevented?
Okay, so menstrual cramps. most ladies experience menstrual cramps. Let me just explain in simple terms why or what the whole thing is all about.
Okay.
Now, the thing is, in the uterus or the womb, we have something called spiral arteries or spiral vessels. So it's spiral and it's woven in between the muscles.
Okay.
Now, for the uterine lining, that has to come off to detach and also come off. The muscles contract so that the vessels will close up. And when it closes up, it blocks blood from flowing to this lining, which is called the endometrium.
Okay.
So once it blocks the blood flow, in medicine, there's something called ischemia, when oxygen flow to a particular area is impeded.
Reduced, yeah.
Exactly. So then the pain comes from the contraction, which actually is helping the lining to detach. Now, the thing is, the contractions is moderated by something called prostaglandins. Now, these prostaglandins regulate the contractions, and the contractions cause the pain. That is why usually the pain with cramps, if you ask it, so it comes, it's like a wave, like it comes, it goes, it comes, it goes, it comes, and it goes. Now, we have people who experience severe menstrual cramps, which we call as dysmenorrhea.
Yeah.
Now, it's normal to experience a level of pain or cramps during your menses. But if it's quite extreme, some people, they even have to be admitted at the hospital.
Wow.
Yes, because no pain med they take actually helps. Some can't go to work. They have to lie in bed the whole day. If it's quite extreme, then you have to see your doctor, do some investigations to make sure that we are not having anything else. Because the normal menses, once you take some pain meds, it's actually supposed to actually help with the pain. But if it's quite extreme, and also usually younger ladies tend to have more of this than
the older ones.
Older ones or after birth. Usually after birth, it tends to streamlines a bit. But before the younger ones, usually it's not regular and the pain is quite severe. Yeah.
Okay. Well, thank you very much, Doc. We've had a short but very insightful conversation. I think that I have picked up some interesting things that I didn't know before, and I'm sure you out there have also learned quite a bit. Thank you for watching, and keep in touch with us through the WhatsApp line. As you know, it's 0550-585832, and also with our hashtag on Twitter, Facebook, hashtag Breakfast Daily. Thank you very much, Dr. Emmanuel Abankra. God bless you. And stay tuned. We'll come back with the next segment, which is the entertainment segment. Don't go away.